All right, Hafiday. So, what is this? Our fourth episode?
Gosh, I can't
I
remember.
think it's our fourth episode, and we have a guest with us today. Do you want to introduce yourself?
I'm the guest.
Yeah.
Hi,
Yes.
I'm Ray Shinohara. I'm a veteran. I'm also a independent social worker.
Hmm.
Yes.
All right. So, before we go into anything else, Happy Mother's Day to all the moms out
Happy
there.
Yes.
Mother's
Happy
Yes.
Day.
Mother's Day, everyone.
And for the what is it they say for the fathers that are moms and what else? Happy Mother's Day or dog parents too.
Happy Mother's Day, Mom.
Oh yes.
Yeah.
Happy
Yes.
Mother's Day, Mom.
Yes.
All right.
Grandma, aunties, and everybody
Yes.
else.
And all my sisters. Yes, exactly. Man, they're gonna be mad at us. Oh, why'd you only say mom? Well, she's my
Well,
mom.
I'm gonna call my mom now.
Well, you better.
Twisty.
Yeah, because you're gonna
My
get in trouble.
mom.
We only got 30 minutes, so make it fast.
And all my sisters and my sister-in-laws. All right. So May is Mental Health Awareness Month.
Yes.
So of course it's fitting to bring Ray onto the show.
That's right. And just to touch on that a little bit, right? Ray, you've been doing this for quite some time, and we need to tell you thank you, right?
Yeah.
And on our veterans as well, right? And I think what we do when it comes to taking care of our veterans, right, has a lot to do with us doing things, us taking care of each other, right? We met early on, and you took care of some things about how you cared for veterans, and you've been doing that for a long time. You created activities, you created programs, and then I think we met one time at Doc's clinic, and we took care of your claim,
Mhm.
right? And man, you shared your story with me that for me was very it really touched me about what you had to deal with,
Mhm.
right? And then seeing you and all the things that you're doing from that point. Um, I recall you going out to go, state to state,
Mhm.
doing that. That was a big thing, and we posted all that on all our veterans chats to let them see what else is going on and the reasons why you're doing it, right?
Mhm.
And then you left and came back, and you did the same thing. You got right back into doing this, and that's the kind of stuff. And we may not always agree on everything, but one thing's for sure, right? We have to respect each other, and we have to get these things done, right? And I think that goes a long way as well for what this month is about, right?
Right.
Is how do we treat each other, right? And a lot of that comes from our mental health, and it's also connected to our overall physical health, right?
Mhm.
But yeah, so thank you for doing all that
Yeah,
stuff.
yeah, it's fun.
And so we did talk about before we started the show, and we were talking about what we're gonna do for the month was the access veterans have to mental health.
Mhm.
How is it on Guam, and what can we do to make it better?
Yeah. So do we have access? Absolutely. We have a bunch of mental health providers, from counselors to therapists and psychiatrists, out there in the community. We have Guam Behavioral Health and Wellness Center that's out there. If anybody is struggling with navigating the system, they are a focal point to gain access to mental health. From the veteran side, we have the Vet Center for Counseling and Therapy, which I just found out today. We have two counselors that are out there helping the veterans. All you have to do, and I just found out today, instead of calling, because there may be an issue with gaining access with phone calling, just go there. So it's at the third floor at the First Wine Bank. Go over there, knock on the door, and schedule an appointment if that's something that you need. There's a bunch of counselors and therapists out in the community, if you have private insurance, that are willing and able to engage and talk to to veterans that are struggling. And the biggest thing that's out there 24/7 is the 988 hotline, where if someone is struggling or in crisis, can call, and there'll be someone on the other line to respond.
And maybe we'll touch a little bit on the program that you were working
Sure.
on over at the Guam Behavioral
Mhm.
Health. You said there was a program that funded um, you going out to veterans in crisis and responding to those
Yeah.
calls.
Yeah.
Talk to us a little bit about
Sure.
that.
Maybe not specifically to veterans, but the population of Guam.
Oh,
So,
okay.
at Guam Behavioral Health and Wellness Center, they have the Mobile Crisis Response Team, which is a team of professionals, usually at the master's level when it comes to education and everything, but definitely prepared to engage with individuals that are dealing with a mental health crisis, dealing with an existing diagnosis that caused a mental strain or issues, people that are dealing with suicidal thoughts or
Mm-hmm.
harm to others. There's a team that goes out in their own vehicle to either transport or de-escalate the situation, because a lot of times when we deal with mental health, it is a very temporary thing. And with these trained professionals, they could go out and de-escalate the situation or help that person understand what's happening with them, so they could calm down and then not utilize any of the services like the Guam Police Department, the fire department, which is also another additional cost to that individual in crisis. But that person would come there and help them understand without having to come to any of these other agencies. And if necessary, they will transport them to Guam Behavioral so they can access additional services from the department.
So you said this is for the whole island, not just for
It
veterans.
is for the whole island, yeah. But
Mhm.
they deal with veterans as well. When I was working there, there was a couple veterans that we met along the way. The program is actually led by a veteran, so if they're dealing with any issues when it comes to being a veteran or just in general, they have a pretty good team that could help the person that is in crisis.
Do we have a database that talks to maybe folks that fall into that category, or maybe even veterans themselves, right? That, you know, we may have had previous phone calls or call outs to a specific location.
Mm-hmm.
Is there something that exists that might already prepare us? You know, because I know at one point the Guam Police Department
Mm-hmm.
was having a hard time with, you know, the way they approach these types of
Mm-hmm.
cases, because, you know, they're usually there and they want to take care of that situation and move on because they got other things to do, right?
Right.
So, is there anything that you know of that's a database
Oh,
or?
there is actually databases that are out there because that's how things get funded, right?
Okay.
So, especially with a lot of these grants that are coming out, there are agencies that are collecting that data. Guam Behavioral collects that data, so they have, data points of if they're a veteran, what kind of crisis they're going through, what kind of treatments that we're giving them from the Guam Behavioral side. On the other side of things, there are other organizations that are collecting similar data of like how many people are calling, 988. They
Yes.
have their own data points that they have to collect as well. And then other veteran organizations, because that's how they manage and keep up with their organization.
And Miss Karina,
Mhm.
you did the proclamation for Year of the Veteran count and registry, correct?
Yes.
So, I
Mhm.
mean, where are we at with like who's supposed to be providing us some of that data? Because
Yeah.
what Ray just told us
Mhm.
is maybe we need to be mining some of that data that he has.
So I think the last email I sent out, we were at 172, and that was just 2 weeks after proclaiming 2025 Year of the Veteran Counter Registry. So 988. I'm not sure that veterans know that they can just call it. It's 24/7.
24/7.
Call it anywhere,
Mhm.
wherever you're at, stateside or
Mhm.
here, and it works.
It does,
Mhm.
yeah. And if you want to specifically talk to a veteran, it's dial 2, and then usually it's someone that. So 988 is a pretty intricate system because you call that number and it's a local number, it goes to a local line. So it's a local person that's answering that phone call. If the it's busy because other people are calling, it will go to somebody else, but it's 24 hours. So no matter what, someone's going to answer that phone call. But if you dial 2 for that veteran, I'm pretty sure it's 2. They have a veteran prompt, like if you're a veteran, dial this. Then it goes straight to another veteran, so you have a peer talking to you.
Oh, interesting.
And I think did we mention the group out in Denver?
Oh no. So we did meet them. They came a few months ago. I think we've met them twice, a few times online.
Yes.
So thank you to the Brienne. Is it Brienne? Am I saying it right?
Brian.
Brienne. De Beer and her
Beers.
team. Cameron Kwan.
Yes.
And then also Wendy Schwartz out of Hawaii, because
Yes.
they sent us gun locks.
Yes.
And we got, I think, 4 or 5 boxes. So any veteran, come and see us to come get some gun locks.
Yeah. And to the point of the Denver group, they actually work for the VA and they do research, right? So they came out here because they were funded by almost like an angel investor of some sort,
Mm-hmm.
and that person said, "I want you to go to Guam. I want you to go to a place in the Pacific, right?
Yes.
Because it appeared that we needed the most help based on this angel investor." So Brianne, who has ties to Guam through her classmate, the former GITA director, Mel Mendiola,
Mendiola. Mm-hmm.
they've been trying to meet each other for the past 22 years.
Mm-hmm.
So when Brian asked the angel investor, "Can we go to Guam?" They said, "Sure."
Mm-hmm.
So that was her ticket to come here, and that was one of the things she started to do out here. So this is VA high level research stuff. So this is not just like some group out in the middle of nowhere saying, "Hey, we're going to do some research and give us a grant." These guys are in the VA doing research, and what we found from them is that there's very limited resources out here. And I know earlier we said there are things that we can do,
Mm-hmm.
right? And there are resources, right? But based on what's in the United States that exists
Yeah.
compared to what we have here,
Mm-hmm.
they couldn't believe that we didn't have even the basic things that they have out there stateside.
Mm-hmm.
And you know, someone like yourself and Miss Karina who have traveled, right? You went out there and you've experienced some things, right? That you were able to take some of that information and bring it back and use it here. And the same thing for Miss Karina. Now, on your end, you did something that's related to mental health for veterans when you went out, and you have that information that they can use that here.
Which
I
one?
know we were talking about it earlier. Gosh.
Was it the trek that he did? What do you
No. He went out there and he visited a place, and this place was able to tell him about more services that existed out there. So it's just more around when you travel,
Yeah.
you get to see things that
Oh,
we might not have here.
Sure. Like, what were we talking about?
It's okay.
But I know.
But
so
it's,
while
You edit this, right?
while he's trying to
yeah,
remember.
I'll talk about when I visited the website at the Las Vegas hospital, the VA hospital. They offer archery, horseback riding,
Yeah.
yoga.
Yeah.
And I'm like, well, where's all of that for us?
Right.
You know, and we just have a CBOC. We don't have a
Uh-huh.
hospital.
Yeah.
But still, I think the services should be available for us somehow.
Oh, we were talking about the veteran mobile crisis response
There you
team.
go. That's the
So
one.
yeah. So sorry. So, but there, because I'm a social worker, there's all sorts of research depending on where you want to get it. So yeah, I guess they capitalized on that grant you guys were talking about to fund veterans to get transported from hospital to hospital, right? So when I was in Texas, they had this program where like it's like just a group of veterans that have a vehicle and they pick up people, like help them with their appointments and stuff like that, or if they're in crisis they pick them up too. And they're integrated with 988 and everything like that, kind of like how we have it here, but they're specific to like veterans, which kind of like helps them out with building their resource capacity too. And I think that's something that we need, as a whole, because we have all these veteran groups and everything. Some of these veteran groups are a little bit bigger. One of the cool veteran groups that everybody hears about is like the Wounded Warrior program.
Yes.
And no shout outs to anybody. Like they all do like a great job. But like the Semper Fi Fund too, where they're helping people financially.
Yeah.
They're helping them with accessibility stuff, technology to help their daily lives, and those are all funded by grants that they capitalize with mental health grants, especially to help veterans and making sure that their quality of life is increased.
One of the things with grants and things out here on Guam, right, is when you're stateside, right, they got all the programs from the VA,
Yeah.
right? So they're states and they're funded heavily. And the other piece that they're able to do is they have larger corporations out there that are looking to offset the federal taxes that they owe.
Oh yeah.
So they take those monies and they give it to places like what you're talking about. Now, if we could work on getting those fundings into Guam the same way, or if we do an analysis of, hey, if these guys are already getting the grant money from, federal resources or corporate resources, if they're going to get it from the corporate side, why are we heavily funding them for resources? Why don't we take some of that and give it to Guam?
Yeah.
You know what I mean? Because we're missing out. If you look at Doge, right, you know that there is so much money that's being funneled somewhere else, and these are to the tune of billions of dollars. Imagine if we could get just a few million to do what we need out here. I mean,
to help the people.
Yes,
Remember to help the people.
and the veterans, right? So
yeah, I'm not trying to put any money in my pocket.
yeah, and let's face it, right?
Yeah.
Some of these folks do, they operations require funding,
Right.
like pay for somebody's gas to travel to and from.
Mhm.
That's a legitimate,
Yeah.
Hey, let's give this guy some funding. Paying for cell phone usage, or computers, or things to get whatever this person is doing to help somebody else, and for us, more importantly, a veteran, right?
Right.
So that's huge. But anyway, I'm going off topic, right?
No.
You're still Oh,
Okay.
you're all right.
But
This is
we
good.
did want to talk about some of the local providers that we have here.
Oh,
so,
yeah.
So Total Guam reached out to us and they introduced us to Dr. McClure.
Yes.
So we've been sending some veterans there, and then there's still Dr. Lighthizer.
Yes.
And then Dr. Root at the Solomon's Port. She's at Weston. And then there's Urbano.
Yeah, Colonel Urbano.
Who now is with Dr. Acoma's practice.
That's right.
And then I know, Ray, you said you wanted to explain a little bit about the differences between the...
Yeah, McClure's the psychiatrist.
Yeah.
Root and Lighthizer are psychologists.
Mm-hmm.
And I think Colonel Urbano is in the mental health field, but I think she falls as a nurse practitioner, right?
Mm-hmm.
So those are the ones that we have that are outside of the actual VA employment.
Right.
But I think they could be contracted. Right?
Well, no. I think so. For the veteran to see them, if they're in the VA system, they have to get a referral.
Yeah.
To see
So
them.
they're care in the community.
No, they'd have to get a referral.
So
Yes.
it's that business of how you get seen has changed also, right? I mean, my understanding from the VA is any veteran should be able to go anywhere and say, hey, I'm not feeling good. Can you take care of me? And somebody should take care of him.
Yeah.
And I think the VA would foot that bill. But we got to look into that.
Yeah, I think what Karina was like talking about, especially from my field, right? So like when someone's dealing with like stress, anxiety, anger, depression, suicidal thoughts, we hear like go see a counselor, go see a therapist and stuff like that. And like we have to like take ownership of our health, and we have to know where to go, and a lot of us aren't professionals, right? So as advice when it comes to the mental health field, like when we think about counseling's like there so you can talk to somebody, right? You have a lot of like built up emotions and everything. You just need someone to talk to that isn't going to judge you. That's what a counselor is really there for. A therapist is going to be there to help you change behavior. So if you're dealing with anxiety, you're dealing with stress, you're dealing with anger, you're dealing with addiction, you would see a therapist to as an intervention to change bad behaviors to make better behaviors. If we're seeing psychiatrists, those are for medication management, can do therapy as well. But like now you're dealing with chemicals in your system, because if you think about the relationship we have with our feelings and the experiences we have, it's all chemical reactions into our body, and sometimes we need to introduce a different chemical to make us feel better, to make us live better, to give us a better quality of life if we're struggling with the chemical imbalances that we have naturally in our system. So the biggest thing is getting assessment, right? If someone's dealing with something mental health, whether it's stress, go to the VA, get an assessment done, ask for help, but also know what you want out of it, right? So if you're dealing with stress and anxiety, be honest with it. Let them know that I'm dealing with this and I need help. So then they'll send you to therapy, right? If you just want someone to talk to, you're better off going to the vet center, establishing an appointment with one of the counselors over there so you can talk about what's going on. And a lot of times with that conversation that you're having with that individual, that provider, they could connect you to other resources that can help with your quality of life in general.
Yeah. Which is a good segue into HMI, the nonprofit organization. We talked about how getting them access to services and money helps a veteran.
Mm-hmm.
So that's what HMI does. They teach the 3-day benefit boot camp. They teach the veterans how to file a claim on their own. And it might be a journey to get there, but once the veteran gets connected, they get service connected, they have access to services.
Absolutely.
Free healthcare, free medication. access to all the doctors like we talked about. And then the VA also, even though we did mention the doctors earlier, the VA also has in-house providers.
Yeah, and I think there's a lot to be said about this. Has a lot of stuff to unpack,
Oh
right?
yeah,
I
for
mean,
sure.
we're not going to get everything in on this
Yeah.
30-minute segment,
Yeah.
so we'll probably do it on the radio or at another time, right? But like things like medication.
Mhm.
So medication and like counseling, right? They kind of go together
Mhm.
hand in hand. And
They
I don't know
can,
if I'm
yeah.
using the same terminology, but they you have to the best outcome is using both, right?
Right.
And
And I think a really good point to that is if you are on medication, if you're watching, stick to your medication plan and your management because you always have that class. Your provider's always going to tell you, stick with it. If you skip 3 weeks of your medication and you're still telling your provider, I'm taking my medication, you just skip that plan. You need to talk to your doctor about that so you can get reevaluated, reassessed to either manage your prescription or change it because it doesn't work.
Yeah.
And a lot of people are struggling continuously because they're not sticking to their plan. If medication is what you're on, make sure you stick to it.
and it's titration, right? Is what they
Yeah,
call, because most mental health maybe not as similar to other
Mhm.
types of medication, right? You have to take this over a period of time
For it to
before it
work.
starts kicking in,
Mhm.
right? And maybe a lot of our veterans might be used to, hey, if I got a headache, I go take Tylenol,
Right.
I pop it, and the headache
Right.
goes away.
Right.
That's not the same
Yeah.
thing. And maybe, right, what we're talking about here just might resonate with them and let them know, hey, yeah, you're having a tough time, but no, you're not crazy that,
Yeah.
when you take the medication, it doesn't work, and,
Right.
oh, the counselors are not doing their part, right?
Mhm.
Understanding what we just talked about is
Yeah.
probably a huge thing and might go a long way to help our veterans to say, you know what? I'm glad they told me that, because,
Yeah.
if I didn't know that, everything I took didn't work for me.
Mhm.
And it probably didn't work because they weren't taking it the way they were supposed to.
Right. Right.
And even more to that, when you start taking these medications and you've been taking them for a while, when you're going to go off of them,
Mhm.
you also have to ease out of it, right? You don't just
Mhm.
abruptly stop
Yep.
that medication. So again, that's the difference between mental health medication versus other medication,
Right.
right? So, it's good that our veterans and those that are around veterans
Mhm.
hear what you just
Yeah.
said, right?
Absolutely. Another good thing to talk about is like there's a lot of people that are watching this right now
Yes.
that aren't in the field that I am, that don't deal with the veterans that we do, and are dealing with your specific and individual issue, whether it's mental health or medication or whatever. If you don't understand, and when you go to the doctor, they're going to give you all this stuff. You may not understand it
Right.
at that point either. But if you need help navigating, ask again. Ask your provider again. Ask someone who is in the field. Ask me. Like, I'm always available for people to talk to. And I talk to them about their medication and their plans, right? Some of the side effects that are happening, why we're taking additional medication on top of that. I don't prescribe. So, like, I just help them understand what they're going through. And then it starts to make sense of why they're exhibiting some of these behaviors or why the medication isn't working. A lot of times it's, I forgot to take my medication.
Yeah.
Right? It's kind of like when you're planting. A lot of people say I killed the plants, or the plants, like I'm a bad farmer. Like a lot of times we just forget to water it.
Yeah.
And that's the reality of it.
Or you do too much, right?
Or
you
overwater
put,
it. Yeah.
Yes, or you put too much
Yeah.
fertilizer.
Mhm.
Or Miracle Grow's good for a farmer?
Yeah.
So-
Depends on the farmer.
Okay. All right. So,
So we were
What else do we
talking
have?
about access to healthcare and benefits. So
Okay.
so I do want to talk about the next boot camp. I mean, by the time it airs, it'll be over. But the next boot camp is this week, right?
yes,
Yeah, this week.
tomorrow,
6,
Wednesday,
7, and
Thursday.
8, Jeremy Newby Center
Talafofo, yeah.
and Telefo. And the next one is going to be in Aspen.
Yeah.
So that's going to be June, what is it, second week?
Yeah, second week of June.
Second week of June. That's going to be at the Aspen mayor's office.
Yeah, mayor's, yeah.
Yes. So to register, just go to www.hmiguam.com, I think. Yes.
That's your job.
Or you can call me and I can help you register.
Okay.
671-682-7631. Did you want to share your info, you said they could call you.
Yeah. It's 487-0352.
Okay.
Or you can find me online. I'm
All
everywhere.
right.
And you know, right, speaking to you from the social workers
Mhm.
side of the house, right? You kind of alluded to it earlier where you said, "Hey, I know a lot of stuff and a lot of resources," because
Mhm.
you're the kind of like the glue to everybody, right? So if a veteran's having a hard time over here, right, you tell them, "Hey, maybe you got to work on this," right? So
Right.
so you're also helping them understand why things are the way they are. I know when Miss Karina went out to Vegas, she was filming these things where they had people there offering the veterans coffee
Mhm.
Mm-hmm.
and donuts, and you know, man, so you walk into a hospital, they greet you like you're the best client that they've ever
Yeah.
had, or
Mm-hmm.
patient, right? Hey, welcome, how are you, come on in, would you
Mm-hmm.
like some coffee,
Yeah.
donuts? Imagine how far that would go
Oh, absolutely.
to really just putting our veterans at
Mhm.
ease. I mean, we should already know that
Mhm.
these guys are probably, having a hard time.
Mhm.
And most folks that go into, doctors' offices are folks that actually need help, right? They're
Mhm.
usually not going there because they want to have lunch and,
Mhm.
spend time, right? They're going there because they need help.
Right.
So that would also kind of give us a clue that when our veterans are going in, right, to the CBOC or any facility, that maybe we need to be, a little bit nice to them,
Yeah.
or at least, make them feel like, hey, okay, how can we help you? A little customer service
Yeah.
and
Mm-hmm.
things along that way, that line would be helpful.
I think in the medical field they call it like bedside manner
Man,
or
yeah,
something
yeah, that's
like
usually
that.
the doctor, right?
Yeah.
Yeah,
But I think it's really cool, especially working at the clinic with you guys.
yeah,
Like, we establish a very individual experience with
yeah,
some of these guys,
Mm-hmm.
and we give the brief and everything.
yeah.
But like, I make it a habit to walk up to the person I'm meeting, hey, I'm Ray, what's your name?
Mm-hmm.
Just so they remember who I am, I remember who they are. And some of us, we have TBIs, so like, they're like, what was your name? Do you remember my name? But like,
Yeah,
but that experience they have, they'll
yeah.
never forget it, because like, who else is giving them that kind of time and attention?
Yeah,
Right.
and with that, right, I'm glad you brought that up, because whenever we're doing these kinds of things, right, that's exactly what it is, right? And you'd be surprised at how these guys, when they come in, right, and we're talking to them, blah blah blah. I said, hey, you know what? There's a guy out there from your unit, right? And the guy goes,
Oh yeah.
oh, I don't want to talk to him, right? I was like, okay, right?
Yeah.
And then, so I don't do anything, and then we're getting done with what we're doing, and then he goes out and he meets his friend. He goes, hey, hi, how you
Yeah.
doing, right? I was like, didn't you just tell me you didn't want to talk to these guys? So I think it's more of being able to be there. And then when they get to these gatherings, right, we always have this thing about, hey, if you need a buddy letter and you served with these guys, this is the time to do it.
Right.
And then they start, talking to each other, sharing their stories, and then they start building that connection with each other.
Absolutely.
So when you talk about having that available, just us talking to them, it's even amongst themselves
Yeah.
that they start developing those relationships
Yeah.
as well. And nobody's out there to save us, right? So we
Right.
got to take care of ourselves, right?
Mhm.
And once we start doing that, I think it'll go a long way with everything else.
Yeah.
So, just to wrap up and just review, the 98's there for anyone to call,
Anybody.
and a
24/7.
veteran shouldn't. Because I know when we talk about PTSD, a lot of veterans have that stigma, like I don't want to say I have it.
Mm-hmm.
But we tell veterans like PTSD isn't just one thing; it's a lot of things.
Yeah.
It could be insomnia,
Mm-hmm.
it could be anger issues.
Mhm.
So, just I guess a last message to veterans, if they are experiencing something, what would you tell them?
Yeah, absolutely. So our military culture, it was always suck it up, right? It was always drink water, change your socks, and everything. Guess what? We're not in the military anymore. We have to put that burden that we put on our shoulders, like just take it off,
Yeah.
right? We're human beings. We hurt and we need help. And if you're that individual that needs help, ask for help, because help is out there.
Yes. Well, that's all I have.
Yeah.
Until next episode.
Yes, thank you everyone for listening, and keep tuning in. Thank you, Ray, for coming
Yeah,
on.
it's my
yes.
pleasure.
It was fun.
All right,
Okay, next
Okay.
time.
bye everyone.
Bye.